welcome to 6th CSO Digital Health Summit. Myself, Neeraj Lal. I am Senior Group Vice President for the Medicover Hospitals in India. I request everybody, my panelists, I'm giving few seconds if you can explain about yourself, your company which you work, and what are the areas of specialization you work.
I am a neurosurgeon by training, and thereafter I've been a healthcare administrator. So currently, I am the executive director of Jim Care Hospital. But my passion for digital health goes ways back when I was heading the Columbia Asia Hospital, which was the first paperless hospital in the country way back in 2007. And thereafter, I have been trying to, work a lot in the digital health space. Currently, I also chair the Digital Health India Association, where we are, doing initiatives in the telemedicine ecosystem. So that's as far my introduction goes. I'm happy to be here to share whatever I've learned, and I'm happy to learn from all of you.
Yeah, hi everyone, and thank you for this opportunity. So I'm Dr. Subhrojyoti Bhowmick, and I'm representing Peerless Hospital, Calcutta, which is a 400-bedded hospital in the city of Calcutta. By training, I am a physician and have a specialization in clinical pharmacology and clinical research. My experience of digital health would be primarily with my 3 years of experience at the Stanford University School of Medicine, where I kind of experienced it hands-on. And then right now, I'm due to the pandemic, I would say, fortunately or unfortunately, I'm part of the digital health programs, which is ongoing at my hospital. Along with that, I am also functioning as a consultant for digital health program at the State University of Technology in West Bengal, which is the Maulana Abdul Kalam Azad University. Looking forward to a great interaction.
Good evening, everyone. I represent Chandra, Nethralaya, one of the India's premier eye hospitals in the country. We have been rated as in the top three over the last 25 years or so. I work as a Chief Information and Technology Officer. My area of specialization is largely on technology, and I'm currently implementing a massive digital transformation program, which has been accelerated due to COVID right now. I am excited to be part of this panel. I am keenly looking at contributing my experience and knowledge, what I have gained over the years, to the panelists. Thank you.
Thank you, Neeraj. My name is Jay. Short name, you can call me Jay. So I work as a president of HIMSS in India. HIMSS is one of the leading thought leadership organization. I'm also the senior director in Oracle, responsible for health sciences. I work very closely with various systems, the governments, especially on the EHR adoption, driving the health sciences portfolio of products for Oracle. Thank you.
Great. Thank you very much. I welcome you all in the wonderful panel. I think pandemic started and now the vaccine have come. So I think more than a year we are into the COVID world. The telemedicine practice guideline 2020 have come. People are talking about how future patient will look like, how we do remote monitoring, which is the new normal now, data-driven clinical decisions. So many things are there. So I want to go to Mr. Chandra Mouli. If you can take this, do you think this new telemedicine practice guidelines which have come will help drive the adoption of telemedicine practices in our country?
Let me tell you, the practice of telemedicine in India is something like 20 years old. People have been doing in bits and pieces, with some institutions with clarity, some with lack of clarity, some have taken it forward a great deal. But announcement of telemedicine practice guidelines, I can say, is a watershed moment in the not only in the history of telemedicine, but also for digital health as such. And my reason for saying so is that what we couldn't achieve in 20 years, we probably saw in the first 20 weeks of after telemedicine practice guidelines having been announced, people started to adopt it. Now, the reason could be twofold. One is, of course, the guidelines came in, but the guidelines came in response to the requirement of dealing with the COVID pandemic. So if there is a good thing that came out of the pandemic, that was a fast forward for digital health in India. So telemedicine now is, permeated almost every corner of the country. Lot of doctors are using it, patients are preferring to use it. So it is here to stay. Now, how it will move forward is because there will be a lot of changes that we will have to bring about in the telemedicine practice guidelines itself. There are a lot of gaps there for scientific and rational adoption of telemedicine and to go forward. But it all has to tie up with the NDHM, and all that has to come together. And telemedicine per se will become the basic unit of consultation in the digital health ecosystem. If you think that the primary healthcare center or sub-center is the unit of consult in a broad world of the healthcare ecosystem, then telehealth or a teleconsultation will become the unit of the digital health ecosystem. It is the basic, so everybody will have to follow it.
Right.
How soon it will happen, we have to see. But it is here to stay.
Actually, there's quite a bit of a history as far as Sankara Nethralaya is concerned. We were the first in the country on tele-ophthalmology to start something on tele way back in 1990s. Dr. Badrinath, who's our chairman, had been passionate. He has been the first president of the Telemedicine Society of India as well. I think there is quite a bit of a legacy to this whole idea of tele in India. And unfortunately, it took a pandemic to really drive a lot of this transformation that we are talking about. But to share you some of the experiences that we have in the most recent past, particularly post-pandemic, to what it has been before. I think earlier, we had a very hard time working with proprietary technologies, where we were partnered with ISRO to take a satellite links and doing it in a very, very hard way with our rural ICAMs and things like that. But post pandemic and post digital and internet, I think this really aggravated or accelerated the adoption differently. The fact is that we have seen more than 10,000 such patients in less than 7-8 months, speaks volumes of what it has. So definitely, for sure, it is gaining acceptance, particularly in areas where we really see. And largely, I would definitely say the adoption has been a perfect storm brewing with the pandemic in the horizon, and consumer preferences, the patient preferences shifting towards remote health, probably at least in terms of advisory. And most importantly, doctors looking at, because of the practice changes and the adoption of the tele guidelines that the central government put together, also really helped in fast tracking many of these things. Certainly, in my view, it is driving a lot more of things which we have not seen before, and we see this really sustaining as well. I think we have done some lot of innovative work in the tele area. I think certainly this is going to be the order of the day.
Okay, great. I was just thinking, before pandemic, our doctors used to consult less than 2% on a video consultation, and now I've seen it is over 30% they're spending time over video consultation. So my second question goes to Mr. Jeyaraj. This pandemic has brought devastating effect in the adoption of technology. So the video consultation, the telemedicine practices have increased. So what do you think? The change will be there for long? And if long, then how will the new patients look like?
So I think, in my view, clearly, digital transformation adoption is here to stay. I think COVID certainly kind of brought in the need, right focus for us to really look at technology in a much more in a holistic way. I think if you look at pre-COVID, I think Mr. Chandra talked about like how PPG kind of brought in a lot more focus. In fact, a lot of doctors had this concern whether is it legal or illegal in India to practice telemedicine, right? Whether what to prescribe, what not to prescribe. So there's a lot of gray areas. In my view, I think the TPG guidelines come at the right time where it really give a much more clarity in terms of what typically a doctor should do. Even I remember in some states in India have even went ahead and banned telemedicine. We have to go to the court to really get that approved. So I think that was the situation prior to that. But I think the whole path toward digital transformation is going to continue. I think now each hospitals are looking at how do I engage patients in a digital medium much more effective way than how they used to be done before. Clearly, the CXO standpoint, I think there has to be much more investment on the digital health and how they will really look at the whole practice end to end and how to redesign that to meet the needs of the 21st century.
Now with the help of this apps and all, I have seen most of the hospital in pandemic time have started a website where you can see what amount of beds, how many beds are filled. There you can go. I'm sure in the cities like Delhi, Bombay, Calcutta, and Bangalore, I've seen most of the state government have started this thing. It is like book my show. Whenever I want to see a film, I check on book my show and say which seats are available. So my next question is to Dr. Subhrojyoti Bhowmick now. After bringing technology into the healthcare, the transparency of the system have increased, like COVID beds. Do you think it will affect the expectation of the patients?
Yeah, I think it's not going to affect the expectation of the patients, but also increase the affect the expectations of the hospitals as well, because we have to kind of deliver what is being shown. So I can tell you that there is a huge requirement. This requirement was there before also to show how many beds were available and what was the rates. And if you look at the accreditation process in India, one of the major pillars of accreditation in any hospital, whether it is in Calcutta or it is in Bangalore, where was that you need to be transparent about your rates, about your bed availability, what you're talking, take your consents properly. So definitely it took a pandemic, as Mr. Chandra was saying, that you took a pandemic to put some of these basic things on paper and make it more transparent. Though we were supposed to be transparent when we were a NABH accredited hospital, but never ever we were showcasing our bed strength. It was very difficult. But having said that, there is this challenge of the technology being in real time, and I can tell you that sometimes these dashboards, they are not updated. We have the patients have come to the hospitals, whereas the dashboard showed that there were 3 beds and actually there were no beds. So there needs to be a lot of expectations from the hospitals also, that when these dashboards are in real time, and transparency also is required from the different stakeholders, not only the hospitals, because the hospitals, of course, are understood that when we are talking about private healthcare, but then, when the government is also concerned, the transparency is equally expected from their end. And very sorry to tell you that these dashboards which we are talking about, at least in few instances, these dashboards were not working. These dashboards were not they were not real time. So I think it has also, as an healthcare professional myself, as a doctor myself, some of my expectations were not met when we looked at these dashboards. So there's definitely, these is work in progress, and we can definitely improve on these scenarios.
So how do you see the future of healthcare system in our country now?
Is that a question for me?
Yeah. With
Yeah. So see,
respect to bringing transparency.
I'm a very positive person. I'd like to look at positive things. I would say India, I was just looking at the numbers today. So India is one of the few countries in the world who have flattened this curve. And India is one of the few countries in the world which has got telemedicine practice guidelines, a regulated practice guideline, though it is work in progress. So definitely, I would say that digital health growth is going to be in India, and it's going to be enormous. We have now understood that yes, this is another way of getting in touch with the patient, and the patients do prefer it. So the in a country like India, where 30 to 40% of the technology savvy population lives, as well as when everybody has a smartphone, digital health is going to be the way forward. Few things as a researcher, because I also wear a hat of a clinical researcher, is I would have really we would have utilized this entire information which is being captured on the digital health if the guidelines would have allowed us to do analytics and research, which is not there. So I would prefer that the government should have brought in this particular aspect into as well. And I'm sure that when the TPG guidelines, when the telemedicine practice guidelines, they kind of evolve, they should ensure that we can do some kind of data analytics and some kind of modeling on which can help a country like India to strategize better. So the future is definitely going to be of digital health, and we cannot just run away. I think the fusion reaction, or the fission reaction, if you can say, the nuclear fission reaction has already begun in March 2020.
Yeah, taking from on a positive note from your side, Madam, now next question to you. I always feel how future patient will look like. So can you explain how this technology like AI has brought changes into the healthcare system? And in your opinion, will this change sustain for long?
Yeah.
Request Mr. Chandra to take it
Yeah, yeah,
over.
very much. See, AI is for here. I think there's been a lot of talk on AI, and we are really seeing perfect AI doctor collaboration happening already in certain areas. Teleradiology are things which have been much earlier adopted into this entire AI bandwagon. And more recently in Shankar Nethralaya, I think we co-authored along with Google an API for haptic retinopathy, which is one of the first in the country in the world itself to do something very different, which is called HARDA, which is the Automatic Retinal Disease Assessment. So you basically submit an image to the Google's algorithm. That you would be in a position to really diagnose diabetic retinopathy and really come out with a diagnosis. So what we call it as probably democratizing screening. So in my opinion, will really transform the patient care, particularly for things which had been not been a mainstream for ages actually, because diabetic retinopathy is something like the pandemic right now, what we are really seeing, which is where it's completely asymptomatic and you're unable to really diagnose anything useful, because since you don't do a diagnostics, now you are unable to really avert you really don't care about it and end up with a blindness, possible avoidable blindness. I think this could really transform some of these things much differently. AI is definitely getting mainstream. I think it's just a question of time, and then where we can really see it part of our whole service offering, which could be embedded along with our diagnostic equipments, probably with our EMR, and probably with a point of sale device or something like that. I think these are things which are going to come up in the days to come, actually. I think there is certainly a lot more excitement coming up in the AI in space.
Okay. Now, my next question goes to Jeyaraj. See, what I feel these days, data-driven clinical decision, predictive thing. So nowadays, many technologies are coming which help to make clinical decision based on data collected. So, what is your opinion about it?
Sure. So I think technology is clearly not a challenge, right? The technologies exist for a long period of time. If you look at the clinical decision support systems like CDSS, that has been widely used even for the doctors to help in terms of are they making the right diagnosis to aid kind of decision making, rather not replacing doctors. Right? So that's one fundamental thing that we need to be very clear with. All these tools, whether it's AI, NLP, they all need to help doctors make a decision much more efficient. That's one fundamental thing that I believe. I think the predictive analytics, predictive modeling is absolutely important element. That is where hospitals can move from a curative to a preventive model. Today, I think even today, if you look at most of our systems are rather very much like a treatment focus, right? When the patient gets ill, he comes to the hospital, gets treated. What do we do proactively? Can we do a patient risk stratification? Look at patients who are prone to certain disease profiles within my health system, right? I think that is where the systems has to move. Using technology and tools like big data will really help you to kind of go to that level of thing. And to make that happen, what we have to do is to create a single source of truth within the hospital. Today, if you look at our source data, clinical, financial, operational, genomics, they are like separate islands, right? I mean, it doesn't really talk to each other. So how do we build a clinical data warehouse that will aggregate data from all the different source systems? Only then all these are possible. You can do population health, personalized healthcare. All of these will be achievable. I'm yet to see a hospital in India which really probably would have done this like a clinical data warehousing, combining all these data sources. But clearly, that's a roadmap that we need to move forward.
Just give you example. We in our hospital at Medicover in 16 hospital, we use AI-based cameras. So with the help of these cameras, we use these cameras for the staff which come to the hospital and goes out. When they in the morning they're coming, they're happy, they're going sad. So we capture the emotion where they're happy, they're sad, they're irritated. And an OPD care manager, her duty is to see the emotions of the patient. So whenever she sees the emotion, the patient is sad or very irritated, she proactively go to the patient and check Yes, sir, I came to know you're not very happy, and he got shocked. How you came to know? So AI cameras can take, can solve our problem in a big way. So, Dr. Bhowmick, you see, do you think AI-based technology for predictive analysis is reliable?
Yes, yes, it is reliable. We have to see. I was mentioning about this again and again that we cannot just ignore AI, artificial intelligence. And if you see whatever the evidence-based medicine practices, we have been looking at data, analyzing data, and changing our practice. And that was done in a time-consuming affair. If you look at a normal publication process, it takes 6 months to 12 months. What do we do in a publication? We analyze data from 20 centers in India, which runs for, say, a year, and then we analyze the data. We conduct the study, we analyze the study, we publish the study. So, a lot of time goes in doing that. What AI is going to bring in is instant solutions, and time is money everywhere, whether it is, and healthcare industry needs it even more. So I am a firm believer that artificial intelligence driven clinical solution is going to be in. We have to predict what is in front of us. We also have to kind of, in a country like India, it is going to be an enabler where the number of consultants, where the number of super specialists is limited. So I'm talking about a tier 2 or tier 3 city in Bengal or tier 3 town in Bengal, which can be managed from my hospital, Peerless Hospital in Kolkata, where a radiologist, sitting here can see a CT scan which this person, which is a radio technician, has done it, and he or she can say that yes, within the golden hour, this is a subarachnoid hemorrhage. This requires operation. Don't bring him to Kolkata. Bring him to the nearest center, which is at 25 kilometers far away, because this person has more chances of dying. So I see that yes, this is going to be enabler. A lot of criticism we have that India is not technologically advanced, but you look at the number of smartphones, you look at the number of downloads which we do from Netflix, you look at the number of movies which we the data which we serve on Google. So I believe in the Indians are the best learners. They are slow learners, but they're best learners of technology, best users of technology. So artificial intelligence driven programs are going to be here. I can just give you an example. We are now analyzing our data. We have treated more than 2,500 COVID-19 patients. And according to WHO, a particular drug is not working. But we are going to work on that drug, and we are doing a predictive modeling with the University of Calcutta that if these are the parameters which this patient had, then the drug was not functioning. Why did the drug not function? But in majority of the case, that drug would have functioned. So we are working on it, and we are going to come out with this publication very soon. So the other important thing I would also like to highlight here is that we would require industry academia courses, and that is the reason we would require trained manpower in digital health, which is the next thing I would say. The National Digital Health Mission or individual in the state of Bengal, the university I mentioned is rolling out courses, because it is not about only one Mr. Jeyaraj or one Mr. Mouli, I would say. It is about having thousands of them, and having it is not about one Dr. Bhowmick, but having thousands of Dr. Bhowmick. Who then digital health has to be in our medical curriculum, in our paramedical curriculum, in our nursing curriculum. Then only we will be able to implement it.
I think I fully,
Yeah.
I really endorse what you are saying. So I just want to have one more question from each of you. Start with Mr. Chandra Mouli. How future patient will look like? What do you feel? This pandemic has changed the way we deal in healthcare, and I think healthcare is one of the few sector which was on 24/7 for the patient. So I feel if like I'll give you example. We have created one team here a few days back, and we say measure what matters. We used to say them, like, why can't we make the hospital which is future ready? So how future patient look like? Like we started a OPD, dedicated OPD, which is 300 meters away from the main hospitals. and we are using battery operated car. So every patient does not require a indoor admission. So a dedicated OPD block, and I must say we are the one of the few hospitals in the country have a 5-floor OPD building with 75 consultation room and 150 specialists. So I want to ask each of you how future patient will look like. Mr. Chandra.
I think you can really bundle tele across the entire spectrum of services that we have been traditionally thinking about disrupting OPD itself. Actually, that's probably forgiven right now. With all the rise of the other digital gadgets and equipment that are coming around, I think it is already overdue for a disruption, and we're certainly going to see disruption in this space. So it's going to be available all the time, most of the across this entire spectrum of services that you can possibly think. To take some of the simplest examples, like what we discussed on the AI, I think the kind of medical imaging that is being done right now, probably the first level of diagnostics would probably is already overdue for disruption, which is going to happen in certain areas. Has already happened. I think that will be far more deeper than what we can think. And tele will be bundled along with those lab-related services, I think for sure. Second thing is the OPD is largely, we have seen the rise of the COVID, also seeing a lot of remote care management. I think that is probably not been time tested right now in the last 8 months or so. I think that is also going to mainstay in certain other chronic care diseases, say something which is lifestyle. For example, diabetes, or for example, old age patients and things like that. I think we are going to see a rise of those things in many ways. And things which are probably require long, like for example, we are trying to do certain things on myopia, for example, which require a lot of data that needs to be gathered from the eye. So we are having some smart gadgets which can really understand your reading behavior and things like that, which could require a lot more continuous monitoring of your data from the eyes, and then probably go back to you and really recommend you with the right diagnostics and things like that. I think those are things which are bound to happen. So I really see the future of many of these things largely tele as a very useful platform, not an independent business itself. I think in the first place, where it has to be bundled with specialty services, along with the patient engagement platform, is bound to stay.
The future patient, in no doubt, is somebody who would have experienced telehealth. Now, whether it's a new consult or a follow-up consult, their happiness over using it would depend on their convenience, would depend on, some of them may even just go for it for the cost. But convenience is a major factor that will drive the telemedicine ecosystem, because if you see, it will allow us freedom to travel. It will allow us being in the office and getting our doctor's consult done while sitting at the office during lunch break or coffee break. And you don't have to really take your day off or take a half day out of work. And in the rural India, if you see the amount of time the patient is spending to come to a doctor's clinic is sometimes an entire day. And most of them are daily wage earners, so they leave and they actually lose an entire day's wage. So if you really see from their point of view, can you imagine that there is a farmer who's going to his farm as well as when he's taking his, lunch break, he also has a doctor's consult? I mean, that will be the true digital India, isn't it? And that it is for them that I think it will definitely be used by people immediately after we are all vaccinated and we've all been cooped up at home. There's going to be a surge in a requirement and the desire for people to go back to the physical connect and go back to the hospital the way they knew. So the number of teleconsults that you have now will go down, but it will not go down to zero. But what also happened is that the hospitals have understood the business model around telemedicine. See, in the last 10 months, I'm sure initially you gave it free and now you charge for it, and you've got an SBU in your hospital, I'm sure, which is telemedicine, and you start tracking the telemedicine business and saying how to improve it. So hospitals will get smarter also. They will do much deployments of telemedicine. They will use devices to assist people to stay at home and get them monitored. Where you do home care now and send doctors, you would start using devices and people saying, "Acha, theek hai, ye sara data mujhe mil jayega. The doctor will speak to you. This is the time for consult." So you will start
Right.
working around and developing this telemedicine business unit in your hospitals. So that
Right.
focus will give you different segment of population using telemedicine. So
Right.
definitely we would do a lot more. We would do a lot more in this space.
If you look at India, I think we are putting so much emphasis on tertiary care. In my view, I think we need to switch back the focus back to the primary care. I think that is where a lot of these preventive actions can happen. We need to really redesign the health system in such a way that a lot of focus on primary care. I think that's the first point. Secondly, as Mr. Mouli mentioned, like OPD, what all the functions in the OPD can be done remotely without patient physically need to travel. So literally, hospital, think of it more like a daycare surgery center or a inpatient care only when the patient probably need to come to the hospital. Rest of the functions can be managed remotely. I think the COVID certainly proved that point in terms of it is possible to do such things. And the patients who are in inpatient, the experience has to be completely different, right? Right from the temperature control, the food ordering, everything has to be modernized. I think that's something that expectation for the patient, how to make them more comfortable. I think that's where the smart hospitals kind of really play an important role. And then fundamentally the amount of data that we capture, right? I think now the patients are demanding data, right? Can I look at all the information that I need in electronic format? Even today, I think most hospitals still have very basic clinical data set. I think the point on AI came up, like I think the accuracy of AI will come in only when we have quality data. So I think we need to really expand the coverage of information that we really capture from admission to discharge. I think that's really important as well. I think the other last point is the most of the engagement with the patient stops the moment patient steps outside of the hospital, right? So how do we do the patient engagement? I think we also talked about that. How do we continuously engage the patient even though he's at home or wherever he is? How we can monitor his vital signs? How you can do proactive health advice? I think that's also something that patient would really expect. And last point is actually on the genomics. I think now we understand because of the COVID how genomics plays an important role to look at understand the patient's health traits very holistically. So I think we need to start collecting patient genome data, build a biobank, so that proactively we can look at particular genetic issues, whether it's inherited from patients or through mutations, easily identify those populations who are prone to certain disease profile. So those are the things that certainly people are now looking as we move forward.
Well, with respect to Indian context, I would say that I will divide the future patients into a rural patient and an urban patient in an urban setting. So the most important thing that both the patients, whether they belong to the urban settings or they come from an rural background, they will always want a doctor in person. So AI is never going to replace clinicians. This is one thing. Let me put this upfront. There's a lot of at the end of the day, clinicians, their compassionate touch, their kind of the discussions, the counseling. So AI is not going to be AI is not going to be a replacement. But what will happen is in both the scenarios, AI will be an enabler. I'll give an example. So, as I mentioned, that digital health or technology will work as enabler in a country like India, where still 70% of the population is rural. So, as digitization goes on and digital India movement becomes stronger by the day, we will have more and more kind of teleradiology services, teleophthalmology services, and telepathology services getting stronger in the rural setting. And these patients, I would say, beyond speaking of behalf of the rural patients, their lives will be saved, their eyes will be saved, and if they will be referred in a much more easier time and in a easier manner and to the tertiary centers if required. The urban patients, I think Mr. Jeyaraj has wonderfully discussed that they are going to become more demanding because as technology gives us more power, we kind of become more impatient as well. So I think we at like Mr. Lal and we who are serving at hospitals in bigger cities in India, we have to understand that apart from just having a discharge certificate, they will not be happy. They might require their entire stay digital health data to be kind of sent to them, and we might give them gadgets which might monitor them over a period of time. So like as people have them on their on their iPhones or on their smartphones. So they would require more access to data. But having said that, a lot of work is required in the regulations of the Indian environment, because we still are not very clear on the confidentiality part and the data protection part. So I think that is going to change what the patient can access and what the patient cannot access. So that is a very important issue which we need to take care of. And lastly, being a clinical researcher to the core, I would say, if this entire data which we have, whether from the rural database or from the urban centers, if they cannot be utilized to the fullest potential for doing research, for answering real world problems, then the entire effort of digitalization will go in vain in a country like India, because we need solutions which are specific to our country. And this is an AI can give a solution which is specific to India. We don't need to borrow it from United States. We don't need to borrow it from the United Kingdom. We ourselves are sufficient, and this AI can prove it for us. So I'm very
Right.
positive that AI will be an enabler, but definitely will not
Yeah.
replace clinicians.
True. I think that's very fair. I think it's a wonderful panel. I think post-pandemic dissemination of digital health is happening very well. I think we are the only country in the world. Whatever we do, world largest vaccination drive, world largest manufacturer of PPE kits. I think whatever we do, we all as India do. I think we can heal the world. So I feel the pandemic. I think it has. I think somebody want to note a case study. The pandemic has been better managed by our country than the countries like US, UKs of the world. So I think we are here to stay for a long time. And I think now our country is giving vaccine to the outside world also. So that is all about India. I thank you very much. All of you, you have taken time out. Thank you very much on the behalf of 6 CSO Digital Summit. And I wish everybody
Thank
should
you.
say, take vaccine and be safe. Thank you very
Yes.
much.
Thank you.
Thank you very much.
Thank you.
Thank you.
Thank you so much.
Namaskar.
For more updates from CXO TV, please like and subscribe to our channel.